Let's discuss TCM, the discipline nature properties. The key points. TCM belongs to the category of natural science. TCM has the characteristics of social science. TCM is profoundly influenced by ancient Chinese philosophy. TCM is the product of multidisciplinary interactions. Okay? So traditional Chinese medicine is a life science that originated from the ancient China, focusing on research, human health, illness, and disease prevention. It has a close relationship with the geographic culture in China and belongs to the traditional science category of the Orient. TCM is an important part of the world's knowledge of medical science. Its characteristics and properties are discussed in the following sections. TCM is characterized by its natural science nature. Natural science is a subject which studies the law or nature of material movement in change and development in nature. Medical science is a science system which studies the process of life and its fight against disease. It belongs to the category of natural science. The study of TCM is focused on human beings, especially on the basic law of birth, growth, aging, and health. TCM also emphasizes the mechanism of physiology, pathology, and disease prevention. It has the characteristics of medical science. Therefore, TCM belongs to the category of natural science. TCM has the characteristics of social science. Social science is a subject which studies the change of human society and its development. Human beings are not only the highest product of natural evolution, but also have social attributes. TCM focuses on studying different physiological functions from different angles of social background. It also studies the social roots and personal relationship and how they affect the physical as well as the mental health of human beings. These features reflect distinctively the social and scientific characteristics of TCM. Next, the mutual influences of TCM in ancient Chinese philosophy. Philosophy is a science which studies the general rules of the common movement in nature, society, and thoughts. The development of any object is related to philosophy. The interactive relationship between TCM and philosophy is reflected in two aspects. Firstly, TCM has constantly receiving the development of philosophical research during its process of formation and development. Since its initiation, TCM has unceasingly absorbed research progress from ancient Chinese philosophy. A series of TCM phenomena may be explained through important philosophical concepts. For example, yin and yang, a philosophical concept of Yuan Di Neijing, is used to explain the relative attributes and the relationship of the two opposite aspects of correlative things or two opposite aspects within one thing. Combining with the other terms, it formulates the special TCM terms which are used to explain the physiological functions and pathological changes of the human body. Therefore, yin and yang is a methodology which is used to direct the development of TCM theory and is also applied repeatedly in TCM research. The same concept is applied to the theories of Yuan, Qi, and the 5 elements. Secondly, TCM enriched the developed ancient Chinese philosophy. For example, the relationship between yin and yang and the laws of promotion. Restriction, counter-restriction, and over-restriction among the 5 elements were first put forward and fully discussed in the TCM literature. Many philosophers also use the TCM theory to do philosophical research. Therefore, TCM not only enriched ancient Chinese philosophy, but also promoted the development of the ancient philosophy. Next, the TCM, a product of multidisciplinary interactions. To a certain extent, the development of TCM is also the medical application history of multidisciplinary knowledge. Besides ancient Chinese philosophy or ancient astronomy, geography, meteorology, penology, agronomy, biology, botany, mineralogy, specialties, mathematics, and metallurgy played an important role in the initiation and development of TCM. For example, meteorological knowledge is an important factor in the development of the initial theory of the 6 climatic pathogens. By comparing the 4 seasons, TCM recognized the differences in pulse according to the changes of the 4 seasons. With knowledge of geography, ancient TCM scholars developed the theory of treatment according to the environmental changes. Therefore, TCM is a product of multidisciplinary interactions. Multidisciplinary knowledge promotes the development of TCM. Thank you for your attention.
Let's continue with interviewing techniques. This time we focus on urination. Urinary disturbances relate not only to kidney and urinary bladder imbalances, but also to various forms of pathogenic factor, such as dampness and hot and cold conditions. It is important to ask about the frequency of urination, the amount, color, and odor of the urine, and whether there is pain or discomfort upon urination. If there is kidney yang deficiency, the kidneys will not perform their task of transforming and transporting fluids optimally. The untransformed fluids will therefore drain down to the urinary bladder due to their yin nature. Kidney yang should also control the lower orifices and hold the urine in the urinary bladder. These factors result in increased amount of urine that is clear in color, and the person will have difficulty retaining the urine in the body. This can manifest with symptoms such as frequent urination, urinary incontinence, and nocturia. Kidney yang is used to drive the urine out of the urinary bladder. This means that when there is kidney yang deficiency, there may be difficulty in voiding the urine or incomplete emptying of the urinary bladder. Incomplete and difficult urination can also be seen in stagnation conditions such as excess cold, damp heat, phlegm, and liver cheese stagnation. If the urine is dark and or strong smelling, this is an indication of heat. The heat may be both deficient or excess in nature. The heat will steam the urine, so there will usually be a smaller volume of urine. The heat may also agitate the urine and force it out of the urinary bladder. So even though there are only small amounts of urine, there is still frequent urination or an urge to urinate, despite the urinary bladder being almost empty. The heat can also cause the vessels in the urinary bladder to rupture, so that there is blood in the urine. It is not only heat that can result in there being blood in the urine. Spleen chi may be too weak to hold the blood inside of vessels, and blood stagnation can block the vessels so that they finally rupture from the pressure of the blood that is being blocked from flowing. Heat can also manifest with a burning or stinging sensation when urinating. If there is urinary pain that is ameliorated upon urination, it will be a stagnation condition. The urination itself is also likely to be difficult. Pain or discomfort after urination will be a sign of a deficiency condition. Dampness tends to make emissions, exudations, and discharges become thicker, cloudy, and less transparent. Therefore, oily or cloudy urine is a sign of dampness or damp heat in the lower jaw. So here we have a tabulation of the observation for urine. Dark yellowish and or odorous urine signifies heat. Clear voluminous urine is cold or yang deficiency conditions. Frequent scanty yellow urine, damp heat in the lower jaw. Frequent urination with clear urine is yang deficiency or cold in the lower jaw. Urinary difficulty or incomplete emptying of the urinary bladder. Damp heat in the urinary bladder, yang deficiency, cold, phlegm, blood stagnation, and liver cheese stagnation. Blood in the urine means excess heat or spleen chi deficiency. Nocturia or urination during the night is a manifestation of kidney yang deficiency. Pain or discomfort in urination is stagnation condition. Pain or discomfort during urination, there is heat in the urinary bladder. Pain or discomfort after urination, deficiency conditions. Cloudy urine, dampness, and oily urine is dampness. Thank you for your attention.
Diagnosis according to pathogenic G. as to cold. Cold is referred to as the prevailing chi of winter. This is because cold is the dominant climate at this time of year. This does not mean that cold cannot or will not invade the body or other times of the year, but that cold is most prevalent in winter. Cold is extremely yin in nature. This means that cold can easily damage yang. Cold's yin nature can be seen in its chi dynamic, which is contracting. Its contracting nature means that cold creates stagnations and blocks the movement of yang. This is seen in the world around us, where cold freezes water and stops it from moving. Cold does the same in the body. Cold will stagnate qi, jinye, and blood because it blocks their free movement. There is an aphorism in Chinese medicine where there is stagnation, there is pain. Where there is free movement, there is no pain. This means that pain is a key symptom signifying the presence of cold. The character of pain in cold is typically cramping or biting in nature. Other typical symptoms are stiffness and pronounced aversion to cold. Exogenous pathogenic cold will often invade the body through the skin, where it will disrupt the circulation and the activities of the body's wei qi. This means that the symptoms and the sign of an invasion of cold will be most apparent in the body's external aspects. Because cold blocks the movement of wei qi, it will also block wei qi in its ability to open the pores, and there will be a lack of sweating. Each of the 6 climatic qi has a resonance with the specific organs and channels in the body. Cold has a resonance with the Taiyang channel. Taiyang is the most exterior channel, and it is in these channels that the initial reactions to an attack of cold manifest according to 6-stage theory. Cold is often involved in the etiology of these syndromes. Here, cold is combined with dampness and wind, movement of qi, blood, and fluid in the channels and in the joints. There can be situations where exogenous pathogenic cold manifests with symptoms and signs in the interior of the body. This will typically be when there is an invasion of cold in the stomach and intestine, urinary bladder, or uterus. An invasion of cold in the interior is due to either climatic cold penetrating through the skin to the channels, or the consumption of food, liquid, or medicaments that have cold nature. Cold can block the movement and activity of yang, and thereby preventing it from transforming and transporting fluids. This can result in a clear, watery exudations from the nose, vagina, or respiratory passages. Diarrhea caused by cold will also be watery. The above are all excess cold conditions. Excess cold does not usually exist for very long. It will usually transform into heat, or it will weaken the yang, and deficient cold will develop. Deficient cold may also arise from a condition of yang deficiency. The symptoms and signs of deficient and excess cold are very similar, but pain is more intense and the symptoms are more acute when there is excess cold. The tongue will also have a thicker coating and the pulse will be tight. Deficient cold pain is less intense and is more chronic. The tongue coating will be thinner. The principles of treatment are also different. When there is deficient cold, yang must be tonified and warm. When there is excess cold, the cold must be expelled. For the etiology, exposure to cold. For the symptoms and signs, there is pain that is biting or cramping in character, stiffness and soreness in the muscle and joints. There's aversion to or fear of cold. There's chills, no thirst. There's white facial complexion, lack of sweating, stiff or impaired body movements, no thirst, whitish, watery or clear secretions, tight pulse. Thank you for your attention.
Let's now talk about diagnosis according to 6 stages, an overview. In the theory of the 6 stages, the body is divided into 6 energetic levels that can be affected by exogenous pathogenic qi. The deeper the level that exogenous pathogenic qi has penetrated to, the more serious the condition is. The relationship between the strength of the invading pathogenic qi and the body's zhang qi will have an influence on how deep the pathogenic qi penetrates. The 6 energetic stages are Taiyang, which involves the urinary bladder and the small intestine, the Shaoyang, which pertains to the gallbladder and the Sanjiao, and Yangming, the stomach and large intestine. Next, we have the Taiyin, which pertains to the lung and spleen, the Shaoyin, which pertains to the kidney and the heart, and the Juyin, which pertains to the liver and pericardium. Taiyang is the most superficial aspect, and Juyin is the deepest. Exogenous pathogenic qi can penetrate deeper into the body in the following ways. First, by continuing sequentially through the various stages. Next, by skipping over one or more stages. And by penetrating from the channel down to its internal organs or its partner's channel organ. There may be overlapping patterns where there are symptoms and signs of 2 stages simultaneously. If there is already a deficient condition in an organ or an aspect, pathogenic qi will more easily penetrate to this level. For example, if there is kidney yang deficiency and the person is invaded by wind cold in the Taiyang aspect, the cold can penetrate directly to the Shaoyin aspect due to the yin-yang relationship between the urinary bladder, which is Taiyang, and the kidneys, Shaoyin. In the 6 stages model, it is cold that has invaded the body and created imbalances. Heat can though arise when the cold penetrates deeper into the body. When there are apparent heat symptoms and signs without any preceding cold signs, this is explained as being a consequence of latent heat. Latent heat can arise when cold invades the body in the winter. The cold will be inactive and later transform and turn into heat. In spring yang will begin to rise upwards and outwards. This movement of yang will result in the latent heat being driven upwards and outwards to the exterior, where it will activate the body's defense mechanisms. There will therefore be signs of heat without the person having been exposed to pathogenic qi. Signs and symptoms of heat can also quickly manifest in an invasion of wind cold if there is heat already present in the body. Diagnosis in relation to the 6 stages analyzes the relative strength of zhang qi and pathogenic qi, whether the disease is advancing or retreating. Distinction is made between heat and cold, deficiency and excess, and whether pathogenic qi is located in the interior and exterior. This determines the treatment, for example, whether pathogenic qi should be drained or expelled, or whether zhang qi should be tonified. The 6 stages diagnosis differentiates the following. First, where the disease is, whether the disease is in the interior or the exterior, and if it is only on the channel level of the zhang organs are affected. In relation to an 8-principle diagnosis, the Taiyang stage is an exterior imbalance. Shaoyang stage is half interior, half exterior, and the rest are interior imbalances. What the nature of the disease is, whether the disorder is deficiency or excess, hot or cold. When zhang qi is strong, there will be a Shi condition or an excess condition. In general, it is It is an excess condition when the disorder is in the Taiyang and Yangming stages, and a deficiency condition when the disorder is on the 3 Yin stages. Shaoyang stage is often a combined deficiency excess condition. Taiyang stage is usually characterized as being cold. When pathogenic qi is in the Yangming aspect, there is heat. Shaoyang can be either a hot condition or a combination of heat and cold. The yin stages can be either hot or cold, depending on whether it is yin or yang that is injured. Next, how the disease is developing. Disease development is a dynamic process that is in a process of constant change, especially in the initial stages. The theory of 6 stages can be used to determine if the disease is improving or deteriorating. It does this by assessing the relative strength of zhang qi and pathogenic qi and in which direction the disease is moving. If it is penetrating downwards from one of the exterior aspects, this is a negative sign. Conversely, if the symptoms change and the pattern changes from one of the deeper stages to one of the more exterior stages, it is a positive sign. Now let's go to the treatment principle. The 6 stages diagnosis determines the nature of a disorder. This then dictates the way in which the disorder should be treated. For example, if pathogenic qi has invaded the Taiyang aspect, this is an excess condition, and the treatment principle will be to open to the exterior and expel pathogenic qi using a draining needle technique on points that expel wind cold. Conversely, if there is a yang deficiency condition on the Taiyang aspect, spleen yang should be tonified and warmed using a tonifying needle technique and preferably moxa on points that tonify spleen qi and yang. Thank you.
We shall be illustrating some case history for treatment principles. Man, age 44. This man had been suffering from headaches for a long time on either temple. The ache was intense and of a stabbing character. There was occasionally vomiting, numbness of the right arm, and thirst. He also suffered from tinnitus of the left ear for 3 years with a low-pitched sound. His sleep was not good as he often woke up and was unable to fall asleep again. Pulse, wiry, especially on the left side. Tongue, body color normal, side slightly pale. Diagnosis, liver blood deficiency with liver yang rising. The symptoms of liver blood deficiency are numbness of the right arm, pale tongue sides, and insomnia. The symptoms of liver yang rising are intense temporal headache, vomiting, tinnitus, and a wiry pulse. This is a deficient interior pattern. Deficiency of liver blood is the root as it is the primary aspect of the condition, and the liver yang rising is the manifestation. In this case, we need to tonify upright qi, that is, nourish liver blood, and to expel the pathogenic factor, that is, subdue liver yang. Here, we treat the root and the manifestation simultaneously as the symptoms are severe and distressing. Had the patient had more symptoms of liver blood deficiency and only slight occasional headaches, treating only the root that is nourishing liver blood might have been sufficient. Thank you for your attention.
Diagnosis according to Sangpo organ patterns. The large intestine imbalance. The large intestine's function are to receive the dross that remains after the food and beverages that have been ingested had been transformed by the other organs, extract the last suitable fluids out of the remaining contents, and send the untransformed residues out of the body as feces. These functions are influenced by the spleen, the stomach, and the kidneys. This means that the large intestine is the stage in which these activities take place, but in a disruption of these functions will usually be addressed by treating an imbalance in the spleen, stomach, or kidneys while using points that directly influence the large intestine. The large intestine can also be affected negatively without other organs being involved. This is seen when there has been an invasion of exogenous pathogenic qi. Invasions of exogenous cold or damp will disrupt the movement of qi in the large intestine. The blockage of qi will manifest with pain. An invasion of exogenous cold can result in constipation because cold can block the movement of the stools through the large intestine, but also the blockage of qi can mean that exogenous cold and damp prevent the large intestine from extracting fluids from the stools, and in these situations, the invasion of cold will manifest with watery diarrhea. Damp heat can also invade the large intestine. This will also cause diarrhea, but the diarrhea in this situation will be sticky and odorous. The heat will scorch the mucous membranes, resulting in a stinging, burning sensation in the rectum. The heat can be so intense that blood is agitated to the extent that the walls of the large intestine rupture. This can result in blood in the stools. When qi stagnates in the large intestine, it will result in abdominal bloating, distension, or pain. In a purely excess condition, the pain will be alleviated by passing of stools because the stagnation will thereby be alleviated. Qi in the large intestine can stagnate when there are invasions of exogenous pathogenic qi or when the stagnated liver qi invades the large intestine, interfering with the downward movement of qi in the large intestine. Blood stagnation in the large intestine can also block the free downward movement of qi and stools. There is close cooperation between the large intestine and its partner organ, the lung. The large intestine is dependent on lung qi being sent down so that it can force the feces out of the rectum. Lung qi deficiency can manifest with there not being enough force to expel the stool from the body. In these situations, the person will typically feel very exhausted after they have passed the stool and will possibly sweat spontaneously afterwards. A condition of yang deficiency can lead to cold more easily invading the large intestine and to there not being enough yang qi to move the stool through the large intestine. This will result in constipation. Next, the general symptoms and signs of a large intestine imbalance. So we have constipation or diarrhea, abdominal pain, there is abdominal bloating. Thank you for your attention.
Let's now talk about combined hot and cold patterns as we continue our discussion on diagnosis according to 8 principles. Combined hot and cold patterns have symptoms of heat and cold manifesting simultaneously. These patterns can occur when a person with a state of interior cold is invaded by exogenous heat or vice versa. There will be symptoms from both the exterior invasion and the interior imbalance. There can also be a combination of hot and cold symptoms when an illness is changing character. This could, for example, be when cold in the exterior is penetrating inwards and becoming Yangming heat. Pure interior imbalances can also result in combined hot and cold patterns. There can be situations where there is heat in the upper part of the body and cold in the lower part. In this case, there will be heat symptoms in the top half of the body and cold symptoms in the lower part. It could also be the other way around. But usually heat will rise upwards, and cold will sink downwards due to their yang and yin dynamics. There can though be situations where there is cold above and heat below. This could be when there is an invasion of exogenous cold in the stomach, with such symptoms as watery vomit, abdominal cramps, and no thirst, while there is damp heat in the urinary bladder with symptoms such as painful urination with dark, odorous urine. Furthermore, there are also extreme situations where there is false heat and true cold, and false cold in true heat. It is important to differentiate these two situations from the one described above, in which there is just concurrent heat and cold. Furthermore, false heat or false cold is not the same as empty or deficient heat, or empty or deficient cold. Empty heat and empty cold are when there is a deficiency of either yin or yang, resulting in a relative excess of heat or cold. When there is false heat and false cold, yin and yang are in the process of separating. This results in false symptoms of heat or cold. When there is, for example, empty heat, as in yin deficiency heat, the deficient yin is not able to control heat. This means that the person is hot at night and has red cheekbones, night sweats, a red tongue without coating, and so on. In this situation, there is heat present and it is arising because yin cannot control yang. When there is false heat and true cold, there is almost no heat, but the patient still manifests signs of heat. This is because yang has become detached from the yin, and the little heat that there is rises upwards in an uncontrolled way. The tongue is the most reliable diagnostic tool in this context because it will show the underlying imbalance. It is essential to treat the true state and not a false manifestation. Fortunately, these situations are rare and not something one encounters in a normal practice, but are more likely to be seen in an intensive care unit in hospital. Deficiency and excess imbalance. In deficiency and excess imbalances, we are differentiating between the relative strengths and weaknesses of the pathogenic qi and the body's zong qi. When there is a deficiency condition, one or more of the vital substances or internal organs is in a weakened state. There is no pathogenic qi present. An excess condition is characterized by there being either pathogenic qi present or a blockage or stagnation of one or more of the vital substances, but the body's zong qi is intact. In clinical practice, there will most often be a combination of deficiency and excess. Nevertheless, it is still crucial in this situation to gauge the relative ratio of how much deficiency and how much excess there is, and what it is that is deficient and what it is that is excess. Thank you for your attention.
We continue with depression. This time we discuss diaphragm heat as a pattern. Clinical manifestations: depression, mental restlessness, anxiety feeling below the heart, insomnia, feeling of oppression of the chest, and vomiting. Tongue will have yellow coating, pulse is rapid and slightly wiry. This pattern occurs in the aftermath of an invasion of exterior wind heat. The exterior wind heat moves into the interior and changes into heat. If the patient does not take care, it may give rise to residual heat in the diaphragm, resulting in depression and the other physical symptoms listed. Heat agitates the mind, and the person suffers also from anxiety and insomnia. This pattern occurs only after an invasion of external wind, and it is usually a short-lasting condition. However, if the residual heat is not cleared, it may also lead to long-term consequences, and the patient may suffer from depression for years. Depression deriving from diaphragm heat has a fairly acute onset and is more common in young people and teenagers. It is relatively easy to treat by clearing residual heat, calming the mind, and lifting mood. The pattern of diaphragm heat as a cause of depression is more common in teenagers and young people. It is due to residual heat after a febrile disease, but occurring against a pre-existing background of emotional stress and particularly repressed anger or guilt. Treatment principle: clear the diaphragm, clear lung heat, calm the mind. Points: TB5, LI11, RAN15, bladder 17, DO9, P6, lung 5. All points are needled with reducing method except P6 and lung 5, which should be needled with even method. TB5 and LI11 clear residual heat. RAN15, bladder 17, and DO9 clear heat from the diaphragm. P6 lifts smooth and clears the diaphragm, and lung 5 clears lung heat. Thank you for your attention.